Hi, I'm Kris Baxter. I'm the patient navigator at North Central Baptist Hospital. I chose to be a part of the process of new life because it's the biggest day of your life, and it's something that you remember forever, and I just like knowing that I can help you make that day special. I was a nurse here at North Central when I delivered both of my babies, and I think my first time around I was lost a little bit. I missed some things, and that's how we developed the Navigator program, so that we could help other families get assistance walking through the process. So I didn't know about pre-registration. I didn't know that I was supposed to do some of the things in advance. And so once I had my kids, we came back and said, you know, we need somebody that can help them with that process. So as the patient navigator, I'm a registered nurse that can meet with you to go through the process of getting prepared. We talk about things like how to register for your hospital stay, what to pack in your hospital bag, how to get prepared, what classes to take, and just what to expect throughout your pregnancy and your hospital stay. We cover other topics like breastfeeding, the golden hour, skin to skin, and possibly birth plans. If you're coming into the hospital knowing what you expect, you have expectations towards a list of things that you're looking for, I can help you review those and go through what we offer so that maybe we can help hone that in and get you everything that you're looking for to the best of our abilities. For hospital pre-registration, you can register in person by making an appointment with me. We sit down with our consultation and go through the paperwork together. I'll turn it in and follow up just to make sure that it all gets done for you, and so that you can get a financial benefit estimate done before you even arrive. It kind of helps you to plan that part out as well. You can also register in person at any of our registration desks. You can come up, fill out a packet, and turn it back in. Or you can even register online. We do offer from our main website at baptisthealthsystem.com. You can click on register and pre-register there as well. It's important to find a pediatrician before you come in for your hospital stay. So right now your obstetrician is taking good care of you throughout the pregnancy, but once baby is delivered, baby needs their own doctor. So you will find a pediatrician, hopefully one that is covered by your insurance, prior to coming in, so that we know who you're following up with before you go home. So packing for your hospital stay, we provide everything that you will need for your baby. So we give you diapers, wipes, bathing supplies. You don't have to pack a diaper bag full of stuff. We've got everything that they need, but a lot of parents like to bring outfits or things that they want for their baby. You will also need to bring the car seat installed already in the car, but for you through labor, we'll go ahead and be providing all of the necessary pieces for that. We give you gowns and pads and all the things that you're going to need after delivery as well. Here at North Central Baptist, we have a variety of classes that range from prepared childbirth, where you learn about Lamaze, breathing, relaxation, pain management techniques, as well as baby care, what to do with your baby when you get home, breastfeeding, car seat safety and installation, CPR, boot camp for dads, and tours of the facility. This is one of the most anticipated experiences in any woman's life, and the hospital offers these services complimentary. The golden hour is the first hour after delivery, where we encourage you to begin bonding, skin to skin, and even breastfeeding. We are a Texas 10-step breastfeeding friendly facility, and we encourage you to breastfeed, room in, and bond throughout your hospital stay. We offer photography services so that you can have a photographer in the room for actual delivery if that's something that you're interested in. They actually do still photography as well as videography. You can do it for your labor and delivery, the first bath. They can capture just the regular postpartum newborn sessions as well. When parents are expecting a baby with additional complications, it adds a new level of anxiety. With a referral from your physician, we can sit down in the NICU with the entire team, including the neonatologist, the NICU and labor and delivery directors, the patient advocate, chaplain, case managers, and any physicians that may be involved in the baby's care after delivery, and talk about a plan together. So we can sit down and really review the expectation of what you may see at delivery and after, and then talk about what to plan for your baby's stay in the NICU. After that, we'll walk around the NICU, get you a tour, and help you feel more comfortable and familiar with the space before your baby is born. Very recently, I helped with a surrogate family that lived out of the country. And so working with them just to get flights arranged and trying to make it for the delivery of their baby after they waited years to have a baby. I helped them get through that process, both the legal process, but also just the emotional process of having their first baby and flying hours and hours to get to North Central on time so that they could be there for their baby being born. So that, the true parents lived in another country, and the pregnant person who was the patient was here in San Antonio. So they were coming for the delivery of their baby, and that's something that's even more special, is being a part of those as well. Baptist feels like a family to me because we work together as a team. We all collaborate and make sure that we're all on the same page so that we're all here taking care of you as a group. Caring for our patients is a team effort, and we're here to protect you and help you through this process so that the most important day of your life can be an exciting and beautiful day. Here at North Central, we support family-centered care where we advocate to keep mom and baby together as much as possible. From the time of delivery through your hospital stay, the more you're together, the stronger your bond. So when we come to you to take care of your baby, you don't have to be separated.